Hello and welcome to the next episode of the Explain series with your host Dr. Bret Palmer. In the Explain series we take a sexual health topic and explain it. And this week it's gonorrhea, otherwise known as the clap. So you're probably thinking gonorrhea. Well, it's an old disease. It's been around for centuries really, and no one really knows how the clap, which is what it used to be called, got its name. Whether it was because of a French brothel owner a few hundred years ago, or whether it was because the very old treatment for gonorrhea was clapping the penis on the table with a Bible, which would be a little bit painful. So you're probably thinking, well, what is gonorrhea? Well, gonorrhea is it's a sexually transmitted infection, and it's caused by a bacteria called Neisseria gonorrhoeae, otherwise known as just gonococcus as well. It's more easier to pronounce. Still difficult to spell, but easier to pronounce. And once you have the infection, if you're a man, you could have a pus-like discharge from the end of the penis. If you're female, you could have a pus-like discharge coming from the vagina as well. It's quite unpleasant. With the men, usually 80% of gonorrhea in the penis are symptomatic. So as well as the discharge, it can be very, very painful in peeing. So if you listen to a lot of 1960s music about pissing fire after a one-night stand, that's because the singer's referencing the clap or a gonorrhea infection. You can get gonorrhea of the throat as well, for men and women, depending on what you're doing. And you can also get rectal gonorrhea as well. So gonorrhea of the throat tends not to have much of a problem. You won't know if you've got it. It tends to have no symptoms, and that's called being asymptomatic. Rectal gonorrhea, around about 15-20% of people do have symptoms, and that can be some kind of like a rectal discharge. If the infection is left in men, it can become quite a nasty infection and can go up into the prostate and infect that and cause prostatitis. Then it can go down into the testicles and infect the testes, and that's called epididymal orchitis. There will be shows on each of those as well, or episodes on each of those. For females, the infection goes obviously into the cervix and goes upwards into the womb or the uterus, and that can then track across into the fallopian tubes. And when you infect all of these parts of the body, that's called pelvic inflammatory disease. It can be quite nasty, and epididymal orchitis in men and pelvic inflammatory disease in women can both lead to reduced or fertility or infertility. So it's important that if you do have any symptoms, go to your GU clinic and get tested and treated. If it's completely left and you don't do anything, there is a small possibility that you can clear it. There's also another possibility that it could become what's called disseminated gonorrhea. That's where it spreads all over the body, and you can have these horrible skin lesions, like a horrible rash. If you continue to leave it, then you can really get the very, very nasty complications of gonorrhea type endocarditis, arthritis, and meningitis as well. Either way, these are all preventable if you get regular checkups or get tested at the start of new relationships, and also ideally use condoms wherever possible. Treatment is at the moment relatively simple, so you should be being treated with 2 antibiotics, an oral antibiotic and one that's given by an injection. This, however, is changing rapidly. The problem with gonorrhea is that it's becoming drug resistant, and there are a few strains that the drugs or the antibiotics you need require it to be given intravenously, and that means through the vein. And so gonorrhea is rapidly becoming a more difficult disease to treat. It's also evolving. While I said 80% of men will have some kind of symptoms, 10 years ago, most patients seem to have a pleural discharge. Nowadays, not so many have this pleural thick discharge coming out of the penis. They can still have symptoms like pain on peeing, but as the bacteria is evolving, becoming resistant to antibiotics, it's vitally important that you go and get tested, then get treated, and then don't have any sex for at least 7 days. Ideally, if you can hold off for 2 weeks, that would be better, and then go for your test of cure. Some people call it test of clearance, but tradition is called test of cure. That means it's out of your system, and you've got to tell your partners. So whatever your sexually transmitted infection is, please tell the people you had sex with in the last couple of months, and tell them they need to get tested as well, because they're at risk, and you don't want to cause them infertility or give them other serious complications. It's a nasty disease at the end of the day. If you're pregnant, hopefully you should be screened, but if you're not, you can always go to a general sexual health clinic and get screened as well, and you will be and if you're positive, you will be treated, because you don't want to carry any sexually transmitted infection and pass it on to a new baby. It's not very nice either. So, in conclusion, get tested, get treated, tell your partners if you're positive, and have a healthy sex life. If you want any further information, you can get some more information from the CCDC websites, from Public Health England, from the Family Planning Association, and NHS Choices. And if you like this episode, please share and like and subscribe, and there will be a new episode next week. Thank you very much for watching, and have a healthy and have good sexual health. Thank you. Bye bye.